Everything for your mammoda was someone ya try me a die and walk out baffy ye de and punimpu ebrem when they Friday ain't ye be boom punimpunan sana no minia bema kwame ajetia ne showbiz name yeah AK-47 AK papa eja owo no eye owura kwadwo ajetia eja panya mfie no aduosia num enne 65 years enti opani kwadwo ajetia baby a obi a obakwa me ajetia ne de ode man wo no ene masem ne adwuma yi ne efene ne mrante kwa asem wanya AK-47 say yenyina na namu ne nka nche wo se onyame enhyirawo onfa nkwane bi nka ho oma wa hoden so oma wani gie na oma wa brabomu asomdwie ene ahoto na yenka nche wo se enne ono beba bedida na bom enti ene wo ba oni ni crew ni nyina bedi na chi girls ne beba eche se ona na anom na making oni omo beba na oni wa bedida no abom ti bebia wo bia eye ni gie enhyira empaibo enkwahosan ena wo ba kwame ajetia esre edima ti wa woni mopani Kojo ajetia no na woman happy birthday my 65 years onyame ayebi on sanfa 65 enka hu papa afi ye ba be bom punimpu ye ne Dr. Dennis Laryea ya wo ye national coordinator wo Port Health in charge of Port Health e wo Ghana Health Service ye ne be bom punimpu coronavirus sisi no wo je ne homena wo bumfumpa wo number bia wo hyase wo China eye Hubei province na crew a wo friend say Wuhan e what ne hyase si o nipa be 26 nipa be say na de wo sese a nipa no 630 na wo mu awuo efiri sa coronavirus mu be say 2400 and over na wo mu so a report bi anopa say send ye kan krata nim say wo doctor ni a wodi kampo a ohun ye oyo ophthalmologist o hwe ni yade na so ohun se virus na bose no esede about 2003 assessa CB ka che ni nuanom doctor for health workers say oh mu hwe obi a mu hwe protective clothing ni ade no your friend not saying the warning every man can be say ye hunemura no it happens everywhere wo mo saying the warning no enu na enura nko doctor no so coronavirus no ekuni bi he got infected na ye pese yesuemu ade free say you know atretre enye China nko asem biem aye other countries so asem amansan apomuden ekuompo ekeka sika wo hia wo de bebo dawuro e de acheche omafo na wada wo ho so ene ade countries be say 2026 ena sesia yi wo mo aba beka ho eye Japan for wonom koduo bi kra de cruise ship sesia wo mama na kansuo ni so 14 days wo twam be 3 or 2 days wo kwa aprobo a womo peso beba be landi sesi afi se enkrofo bi womo wosusu se womo eco cruise no womo akofa yade ni biaba ama womo ehwe ye fanipa ni batches womo fa samples no wono akoye test ebi mo prove positive na Ghana de yeti ye se cases be se enkono ana yesusu se ebetimi aye bia no wode koye no enye bia enti ye danyame ase nanso ehse yente na yentwi ye ni se bi ma ha ni aka ne de adi agro eba ene ye no se aduane ni ye di a ya pege ne ni makobi akekaduro bi ni awe bi na etim no ne de asigya so ache eno eye enough na nura ba bi a mekoye obi chia me no osan twen ne nsa o si me de sisi ade me nchia me ma blue give me blue okay those times in Ebola buy no enti ye pese ye di ho nkomo ne ebisa se ye be ye ne den na etimi ye nyina ya da ye ho so na aban tu na namon no na ye nso ankrankre ye ankasa ya pomuden no ya hwe so eye enti na Dr. Dennis Laryea abe doc anope ye da se pa official panso
afen komete ye
adwuma mu boko
se ya corona be de se enya dia ye bitimi adanti ye guso a
mu guso boko batenye boko adwumaden na aba ebe ye nyame wo ho na yete ye no ne yesenka wo ho na nso enko nipam right eba ne se na afa die enipa die abamu afa kura ye adwen ho se asemasinya obentin so betumi anya na human to human infection ye adwen ho
me da se se sha se no na virus no na yen sheda nim ne features and I say kwan fa so nipa binya nti nanka earlier news na buy no na omo say baby ano moton enam emmoa wa ahoro nkokọ ne bunch ne emmoa bebre market animal market bi wo Wuhan ho no nipa bebre a omo di kanya saayare no na omo akosa market no
okay
nti na encheche ne chese omo ko saa ho no eno munya saayare dia na chese firi mmoa mu ena aba nipa but edru bebre no na fe yehu se obi ho a onko ho kra oni Wuhan nya asem anase saa market ni nya asem ebia obi enya saayare ni bi woni fie no so enya bi enti ebe clear say yare betimi afiri nipa ba ko akọ another person hodom enti na the buy no efa saayare no ho no
I see enti as said ya wuche mu de yenim course no poten
se yenim
enti se sia no edian na this coronavirus ne ba poten
abani dian kasa ne coronavirus
okay
na we no difference abamu kakra changes kakra ba virus ni mu virus ayenim dada
oh sir
but virus na dane ne ho kakra
enti tricky
enti ni ya friend novel novel no chese new coronavirus enti so ba kai SARS early 2000s no ya everybody near friend SARS no na coronavirus kroye bia and I think so somewhere in the middle of the last decade no Middle East respiratory virus and also na SARS kroye bia coronavirus kroye bia it keeps changing inti esesana na afa ama yare ne muede because obia enya sa aboa no da infection da inti ba etimi kum nkofo ntempa
okay so yenim no so wo dada na wadan ne ho si se wadan ne ho a ehi na ofiri a wo ba yemu oba nipa
coronavirus de wo mo bebre emmo bebre e wo mo
okay
ena ebetimi ama nipa nso ayare
okay
enti se nsusuye ne ba mu changes ne ba mu na se eba nipa mu a eno na ma outbreak and I say yare ni to be sima affecting nipa bebre no
okay this am bisa sa no on set say in the case of Ebola no omutimi che say o aboa bi ti say apan nti ya yewe no ye benya hwe wo ho e na we nso wa we brief history kakra o de mai say omusenke wo wildlife but wildlife no ye too broad and omude wildlife e ba fish market ena sisi aba be spread nti se bibi wo no mu a se ne ye be hwe ni die ni yie ana bibi ana fe yada ye ho so nti na
se said in fact say last Saturday many food and agriculture organization in Penifono mo Ghana hane bako ye call another station na yedi komo ade bako kan say ye ni bi ho a e wo muam anase virus emu ibi no mo emu ankasem
okay
omo mo yare
okay
but say omo cross ba nipa mu a no mama nipa yare and the kwan omo fast cross ba nipa mu is when ye ne mo no enya close contact it is bia wo waku abo no na de o de be ye aduane anase o ye abo no ofie abo no live in your environment obetimi spread it say na ma na spread ba nipa mu sana na ye very difficult nti one there some of them almost circulate and as more wildlife more nwura mu ni ade mu dada more yare
okay
but they are there
okay
it is a ba nipa mu a na ya na yare no aye serious
nti kwamba nso na fe ba nipa what's the mode of transmission
and ebi ni dey be kind no say obi kum aboa na say in the process of preparing no say ebi awakokun nwamunambi
okay
the moja ebetimi mo no betimi woni moja nti say oye no wan bo ne ho ban se bia o twitwa nam na se bia atwa na abo ne moja ene ne moja afra ebetimi amane sa yare no say yare a ohua bibia ebetimi achewa eno nso ebetimi afasa akwan ne so nti kwan ahodo bebre na o betimi afasa nya sa yare but say no coronavirus na be si nipam
Okay.
It is the same one issue. The issue is that it can be spread from one person to the other.
Okay, so human to human
that's
infection so no best spread the same.
It's no the main one and they say I don't know obi bowa and also or so onya ko na say bia you feel hunima.
Okay.
Any discharge if you hunima na so wanu no ebetimi ama obetimi emwa no wo sa discharge ni mu.
Okay.
Enti ekwan bia obetimi afa so a obenya into contact with sa discharge ibi no say ebetimi intessu anase obi ni hwenu nsuo. Ti obowa ye free baby droplets and no intessu no nkete a untimi fa wani yen ehu. So ohumi ko mu a obetimi enya. Wadamfo no ka say na de uhia no so onchia no. De nti a wo se onchia. Ebia obi bowa say bia ebinum bowa de omo de omonsa ene
kata oma no.
Enti se ye va say ma bowa me de mensa kata man. Intessu ni bia ye mensa menye intessu bia obedi odi wani be hu. But ayesa no se me chiawa and I nipa so yet in a day there are several times I did and sapphire hwena no ye dey sapphire no any and that is how obetimi a transmit it at the end to yourself. Inti apart from say nipa na bowa na wa home akọ mu no and as we blow the nose no wa home akọ mu no. These are the other ways. Inti na ye two amount for so say ye momodin say be ho yen sa.
Okay.
Obi bowa onfa tissue nkata na no obo wi a onfa tissue no onfa hye ben mu. And now to nothing so all running, sir. The first of the tissue na kata one another no and no chance you're fully protected. Because as I said, any nyina di eni behu. Enti ebi betimi a wo sem a wo. Ti the safest any so be rules sir. With semna any issue keke.
Okay.
And now say hand sanitizer. Em say Ebola buy no bia hand sanitizer she no Ebola call kakano and now but I think say habit is
okay. Yes. Na enu achi no won say enso ya sitan with Ebola ba fe ye mpenchia ti say de nipa no ma me blue no give me blue but ye dada sitan mu ye chia ye sopnu mu ye soka mu sa nyama ni na asese no so say ye choke wo ho ye nya hwe yo
a bad say ye society a sebe be say me ba he na me tene me say me cha na one penny e bia make so che ho ana empu no me tena Kumasi for a while nti minim say ye kwa yi a at least omo te anim ne de ye to santine ya chia
chana memende
untimi nka say uduru a ode obe de elbow na say
yeah
it chana de ye nka say njai but what we can do is say watch area no immediately Coronza. It me kai say some during the Ebola time, Kumasi, some of the funerals over Corona or more. Your friend be Veronica Bucket.
Yeah.
See at the end, Oko cherry, Rosa, and I say hand sanitizer, no way use. Those are some of the things I able to me idea.
What about Apomodin Ejuma phone so because they say Argentine and China niya or more case ya fe di I am share will be a buy and nra moko kolebua ye kono Gucci ICU a negative no. Apomodin Ejuma phone so because you say I'm a doctor for the crowd or more come to.
Ever say idea ya yenhye.
Okay.
Kolebuno umsenko yesi binum dwane me de manfa mani anho itimi ndi ho adanse na mum de metimi a kire ne se omo eye nkofo no adwuma no omo share the necessary protective equipment.
Okay.
Na mpo na nra no ya send bi akka ho ama kolebu for.
Okay.
Airport say okwa airports ye staff omo ho a omo any travelers omo ba e screening ni say obeko no ma goggles or ma nose mask or ma apron all as part of the measures no I be boy ho ban no enti eno de ade a yeguso ye na fa so no ye tu amount for so on the protective measures no.
Okay. You remember back to protective measures if you say no here in pa. Na momade ba ko ye airport ya waka ho asemi. Enti flight a efi China eba say o ye transit o say ni main destination na China o. Omo ne omo maka ni nyina sibom fa ba bi fa kon ana mo quarantine mo ana mo ye ne sen cause na amafo keka nsem ti mo ma ye say de Ghana Health Service mo measures a airport city.
Thank you. Ghana na di kan am say you need flight bia direct
from China.
From China.
Okay.
Your airlines, in fact, you share screening nasi wo airport no. In fact, men can say you share. You enhance screening because thing bia na screening dada. International arrivals no obia obefa adibia friend thermal scanner. You share say who share na so who share. They share yellow card. It we're doing some screening measures.
International
arrivals.
Time Ben and Amo yes.
Oh, it's been there for years.
Oh, dog.
Amba. For a few years. International arrivals.
Dog.
We see from now far left. Answer now be immigration. Health staff. Omo yellow card.
And you know matiada. If you say nyame amanfo afa ho ba ko mienu bi ade camera bi ni computer ya akofa immigration for no off you go claim your luggage na camera no dey be there
ebe mo hu so body temperature was right in fact
okay
9 cases na o see investigating
okay
ba ko kwa dey ahomache ne frame me say wanya omo checking in the temperature no was sure
okay
and na ye call investigation
because we do on ma oh pass everybody pass everybody
because
pass
o temperature na papa o dey say musio mo na ho ye share do na mo say nkofo ehwe
oh I see
and that's what was being done
okay
but say no ya mo form your friend a health questionnaire to be failure my answer questions be
okay
baby o call over the past 14 days. It is a China kahwa and no your flag. It's a flag.
Okay.
You bisa for information on baby out. It is a bus bia. Ubia yare will play no more along the line. I see it me contact you or more no more flight ni mu nyina.
Okay.
Either by telephone or if address near traceable like in Ghana had the address na na but at least telephone number. In fact, so or a foreigner crown or abaha the a contact number for ne contact our krumwa after so even in the plane it be for the seat number
okay
because me say nam from him
okay
enti omo immediately around the person omo risk no e be higher than obi a be ote
a
chikra na so ote
okay
enti those are some of the measures now coming to so be free China na ye be your omo as I said no the airlines we don't have direct airline to China. Enti ye bisa na say wako China, then we we ask extra questions, symptoms and everything. But we need symptom I ain't mean ka say e ma onye den enko. Then mom no we give health education as well.
Okay.
To them say they be ya say basi bia when your symptoms be na say bia you will report to a health facility.
Okay.
And then the measures you take say they be ya when se basa a corona crown when you're on fan sign man for. I think so airport on your announcements on in the public address system.
Okay.
And I think so baggage carousel no ha baby omo form bags now. Information was screens in this war. Okay. Man for information on the disease, how to prevent it and what to do say a basa when you're arena. See those are some of the measures.
Transit flights now ebi ankofo free China film ba na say flight abisi no mu nyina babo mu you screen your bomu and I say once that mu to me identify so we know free ha no oba ha and I say there's China somewhere one the trip ni mu no mo be ma sa for no those passengers no you be quarantine or more you be chi omo agina China ya your screening ko I'm thinking na me hwe say ade na wo se na mo from mu no omo be fra mu ni ade no.
The truth is, I mean, if China be do Ghana, the hours you spent on the flight, and the time you are spending in the terminal, realistically, terminal the time in Kenya. Yeah. If what we would have, if we had a situation where a direct flight, and in so many almost free China.
Okay.
But now what we have is that say the G form no answer free China, then we push more. And I say you be more stringent with the questioning and validating all the information you've given. So one no medrobia because now no paracetamol. We try to be extra vigilant with those who have that information. But the other truth is sometimes say obi banners or Asian looking Japanese and not Chinese made them mean difference anyway. But me sure say you know
black
exactly.
difference.
It's be me who I be American or China ni, but they be no for Korea and any other country. And we also don't want a situation where they're discriminating.
No, but this
but
one,
we are careful.
A serious situation that is calling for serious measures. I'm sure they will understand. And
they do.
They
actually do.
Okay.
Because I've personally been at the terminal where one person, now only about 20, near screening back when we, yes, you uncle, no person train. And I'm saying, move on. We don't want you to aggregate here. Just move. And they understand the situation. Even Ghana Nina make us say, yeah, man, yeah. Temperature, your pickets and why share you didn't call you know. In fact, at some point, not the boyfriend, but as much as the boyfriend say you keep on, he also explains otiasie, but he wants us to in temba. Who's a test? No, you can't do the test.
Who say I know Martina say bread. It's in a na pumpurunti. I say sense of urgency. Be so and soon Ghana for now.
But the truth is, say. Noguchi for no more a minimum amount of time or the better test.
Okay.
They can't
minimum
make
amount
it any faster.
How many weeks or days?
Oh, it's less than a day.
It's less than a day.
Yes, it's within 24 hours on my mind.
Okay.
Results no. And definitely inconvenient. But the gentleman kept saying that he knows that it's in the interest of public safety, but I don't know the incorporating them. And I also church and say, and yes, test no you bet me in 1 hour any year delay no no we need
but in such a situation no more quarantine no ana
yes it you be keeping no in and only isolation because it's a suspect.
Okay.
Quarantine no ye say bia Ghana ban decide say Ghana school for Wuhan and I say Ghana for Wuhan ye go for aba.
Okay.
Omo yare, omo ni symptoms. But because omo free baby a yare na si wo kese pan no. Ese ye de omo tena baby a obi anko omo nchen for the period a so when your infection na e likely say obe start to show symptoms.
Okay.
Enti eno ne quarantine enti we quarantine omo yare. But omo symptoms no omo ni isolate.
Okay.
It's what we did for only isolation.
Okay. Yen just had 2 cases. No say you know Ghana ni back.
Oh, yeah, Ghana.
And Argentine no say for
the eno ya kolebu there na means Argentine because.
Okay.
But we na make and no ya Ghana ni ankasa oti Ghana haba no wetu kwan na waba.
Na waba.
No ba no symptoms. Na ne hwan hye.
Okay.
Na ne hwenum nso fi nsuo kakra.
Okay.
And no gucci for your test na nya corona. Na mom no omu
na ya ahwohye no ne hwinimu efi nsuo ne nko ana say no na ye initial symptoms na be from beba
ne obetimi abowa breathing difficulty ohome a ensi so.
Okay.
Obetimi nya sore throat.
Okay.
Nti do no ne cardinal symptoms no.
I will say
but there can be others.
Obetimi abowa.
Yes.
The ohome ebeye den. Ne ho beye hye. Ne mo mahase ne de ne hwinimu be so nsuo.
Ebetimi aso ebi nso nya sa symptoms no. Nti the cardinal one ene ahwohye no. Nti na ye ni abre a ye hwa ahwohye no. Nti ye nya hu se ho ahye de a then we'll probe further for the other symptoms.
Obi wo Ghana ene na mframa mu di obi ani baby amframa na ebofa na efiri ba nti bia na obi wo Ghana wo fie na wonya sa situation we say Ghana ya pe hospitals and clinics eko ansa na oma my referral you see that's the ideal situation po nti the Ghana service mu ye bia no more factor in private hospitals, maternity homes, clinics, and
in fact, that is a very valid observation you've made. And the truth is, like you said, when you be an public sector facility, it's as much as possible we are continuously engaging the private sector. In your private sector, you're teaching hospitals, quasi-government hospitals, military hospital, for example. almost say any more year Jumapa in this fight.
Okay.
We are engaging all the relevant stakeholders, security services, especially at the airport, because a bus will be a banase or symptoms na say be you see a person you quarantine and also on penia. Yeah, apomudin just for yeah security for you bet me I deal with the security implications. Inti no the immigration and say police and national security for them. Okay. You know, we are engaging all the relevant stakeholders.
Okay. Engaging them, we engage you, but say, obi di big kwa na say, obi wa eshe abro so, na early way say, minimum so bibia. Said the bear also mon koye ni bi na aba no na Ebola cases boom krik na obi dwane no. Na manipa no so feel say, then na mo ye me. Discrimination e ho na afi na ebebe mu no nti how prepared the Americans and person me say health workers say in such cases no on be handle no professionally yet they will be protected.
Me that's it. And it's a continuous engagement we are having. Indeed, Kolebu case nearby no as sad as it was, it's still told us see educated staff more because obi knew her. In fact, and I'll quote one of my colleagues. I say in health, who's a soldier for they can die protecting others. But you know, as health workers, no, we can't die protecting people because you would not say if we die in the process of protecting people, why never share iPhone. Okay. So the protection of the health worker is paramount, and that is why the PPEs, no, personal protective equipment, no, and especially for more frontline. Ebola time training baby is the same equipment and I use personal protective equipment.
Okay.
The yan say you best sensitization and some of our colleagues are already going around sensitizing, especially Temane Ridge hospitals are designated say in your case are honey be manager.
Oh, okay. And the designated hospitals here Ridge and it's a general hospital
for now. If we have any suspected case and your be case definition. We say now say you know say BBC say Chinese ni bi ba ho bi kra na ne yem net.
Okay.
And so ye hu Chinese ni na. Also free China buy and na e bi a man for betumika. And no enye that's not what we want to do. We are professionals. There were symptoms no ho. Okay. There were nipa na bi a free China buy 1 month aba. Oni if your team no obi ante ho a we free China aba in the past 2 weeks. Into wa balance and ho e shekra enye likely say corona. Into no and say health workers no any den ye hwe say yen cause unnecessary fear and panic. And I say yen health workers ye dwane dia and say mo maka no and mo de mo nim it I encourage our colleagues and my ye say ye brave it ade na ye clear cry say oh yen share equipment the equipment if they are not there my put in at unnecessary risk. But if they are there, let's wear them appropriately. Na yenye juma.
Okay. Yet it's a Kolebu for no na omo ye insistent oh omo kra no omo free China chedo omo ni na West African countries omo free China by September. And now so can say time symptoms no better ni ho di them say wo period be. Every bay sir.
It's up to 14 days.
Oh, okay.
Within 14 days. Intina because it normally be I say ye bisa nsam ye clear say we no possible say obetimi a case ansana ya because symptoms na ye kan no MC ye nyina ye nya bida ye ho yeshida abowada sore throat ye nyina ye nya bida anti nya
abranche me because fever fever symptoms ni bida
anti ye nyina ye nya bida anti I don't think say ye focus so much on no nko will be right I see yeah, what we call risk assessment. Okay. Nipa no free China buy is more than let's say he's been here for 6 months. Okay. If your team no obi free China embaho in the past 2 weeks and as obi yare in that household. Those are the questions that health workers know. We ask to be sure say we no obey suspect. And sana yakoye test because test ne so ne boy enyafo.
Oh, okay.
If we ubia beba na say fear and panic na ubia ye person ye tester. One time you bring real cases ye test na bia ye kids na asa. And also where they appeal directly to my colleague health workers.
No crowd they say asan ba ni sa no Gucci for no say the omode ye no answer.
No.
I heard opening now or share honum no. Say they need to go get
some more
reagents.
Yes, and especially if the situation where you have a nipa baby aba say yeah the omo if China aba direct because yesterday I was reading online say students in Libya are complaining that they want to come home and all. It is a basi yakofo mamba. They all have to be monitored. Obiso any symptoms I see a test omo. No we will need a lot of the kits readily available.
Okay.
Yes.
Enti ususu say school for no pay any omo aka say bi mu si o say baby a situation is here Wuhan ho no na say ya ban ni empanyimfo ni omo gu nkasasie so nooks na ho no so omo be hwe so omo be fa omo ususu say ebe say ebe kwa akofa wonom aba
no dear em say a buying decision because it has
a
lot of implications.
With me I'm a professional advice.
For me as a professional, if there's no risk of them getting the disease in Wuhan, they shouldn't move. And remember, Omoba, they are likely to be in one flight. It is a bus, say Omo quarantine. Me sure said they don't interact with each other frequently. And as Omunye bebre at a go.
Okay.
But when they are on a flight, it's a risk. Because a bus, during the period they are coming, one of them cry, not just the whole flight is at risk. It is a measures now you put in place in Wuhan to prevent spread. And you're good, and I want to believe it is. Then they don't have to move because moving around is a risk.
But they are also thinking say Wuhan one na dey any chance enti ehwo na kasa no they being there no your risk kese ma omo.
Oh, if you haven't come into contact,
ya quarantine omo.
Into contact with Obi Oyaya, you won't get it.
But once a while, we say from mamu yade, and once a while they step out to go and get food for a week. They mnene kasa no pe say wakwa konya food stock for maybe a 1 week.
Good.
Until once a while he steps out, he stepped out and ran with the bicycle. So once he steps out, is he not at risk? Until was stepping out in Wabeshe inside, he may be indoors, but because of stepping out, kakranity, risk be.
So just step out, not taking the necessary precautions, and your risk.
Okay.
But what I'm making say, it's all well and good. They can be brought in, but as I said, if the risk is not there, there's no need to move them. But see your risk assessment, not see your stress. Almost continuously staying there, no, a risk to them. And the government has the resources because, like I said, they have to be kept somewhere for a minimum of 2 weeks. Almost now for 2 weeks, and then we'll make sure that they are able to, we monitor their symptoms for the period. Yes, they are any. So, and that was going to come with a cost. For example, they are feeding, and see a provided security for them. All those costs, who is going to bear them? It is no longer a health decision. And now, we need health workers to constantly monitor them every day whilst they are in their various quarantine places. There are a lot of things at play, and we need to look at all those issues and suddenly decide whether they would have to be put in quarantine. Again, it's the numbers. And every number we bring, keeping them in whatever designated place. Everyone is there. We decide to go and put them in one of the halls in Lagos, for example.
Okay.
For the period, they will need security because they don't have to move out.
Okay.
They can't move out until period national. They have to be fed. They have to be entertained. Because they will be questioned them also providing BBR for them because you are keeping them in a room for a period. They can't even interact with relatives. Maybe on phone.
Okay.
But that's about it. Implications outside health and decision. But for us, the key thing is that their continuous stay in Wuhan, if it doesn't pose a health risk for them, yes, socially it's a problem.
Who can say any risk assessment?
Yes.
And saying
into risk. And I say, for example, say what is the risk of him getting the disease? How protected are they? Are they wearing the appropriate face mask? Is it such that they don't come into close interactions with them? Such that, because you need, were around. Maybe a door handle be more or a ball go. So you need those risks to be there. It is a omo putting measures are no main intimacy. Everyone say shop no car. They've decided that you go and buy what you finish, you leave before the next person. I don't know what measures are there.
Done.
But if they put in measures such that you are running to spread there, then they should stay.
Okay.
In terms of the risk assessment.
But you think say omonomu nim ana because ebi mo say mo me fa yemra, ebi mo so say o de mo amonya assessment say they are okay. Basa na it afi de ehu abem panic abem.
Yeah, I mean I understand social aspects no there and as a psychological aspects it's clear. Look, if you are kept in a room for a long time, because who names or next door neighbor, I'm sure people are even refusing to interact with themselves.
Yeah.
And being in isolation, and no quiet, a bit more psychological problems.
Okay.
And that could be the reason why a lot of them would advocate to come.
Okay.
But as I said, if the risk is not there, or if the country is prepared to bear the cost of quarantine people for the period, because I don't know the numbers and I can't tell what the cost will be.
Usually they give us a rough figure, maybe a BB around 100 or a BB, because when we say province in eso and then see one and almost say universities and so me no be so ya kese omuni Wuhan and Kasa and say nearby, but once they are close to Wuhan, say me borrow word now, they are also at risk in a way. And see a man in na aye way kakra.
And then the other thing, you know, I saw a picture on Twitter, and this is not one of those fake pictures, but Sri Lanka, among the airline among citizens from Wuhan to Sri Lanka, and even the pilots and the whole crew, no PPEs.
Yeah.
They Ebola patients, no motion, whites, no with the goggles and everything. It's you pilot pictures, they be pilots, no cockpits, you know, they were in the full PPE. So it's not just about going to pick them, but we have to do a lot of stringent measures.
Now we have to know, are we not? Because yet say ministry, so we are on course. Ghana Service is my insurance.
And I mean, so this is for those. If we decide say you conform by now, those measures would have to be put in place.
Okay.
And it's not a very simple thing. Go and pick them in.
Okay. Yatisa buying so we try 2.5 million at the atu say the be boy and who buying was Ghana Health Service mo chef and woman is saying one say ya catch a monsaka. What are you going to use it for? And
they made a sick assembly the minimum answer. But what I can tell you is that we took delivery of 5,000 personal protective equipment with all those things. We are distributing them. In fact, I am kolebuphobia, as I said earlier, and we are going to distribute. So, and that PPE is coming from that money. As for saying Ghana Health Service there, I don't have that information.
But PPE are there per muhia.
It's one critical thing because you suspect you be you're taking a sample, you're afraid to be throat swab, and I said nasopharyngeal swab.
Okay.
You're the BB said the AD, you're the befa minimum to take the sample. I don't need the beko no Gucci near Trinimoja. Or more mobile they have to wear that full PPE to protect themselves. Okay. It is a BB side new, not just a lab no cry into me because you need be. It's very critical as far as the health sector is concerned.
But apart from PPE, no more reagents and anyamuna more testing.
So Noguchi has the equipment. We need to buy more.
Okay.
Be sure say some of the money will be allocated. They have some, but I don't know what the state is. I don't work in Noguchi team person, but me Profampo kasa about it before, and he mentioned that they have that they can test. He's worried about the quantities, so that's what I'm saying. Once the money comes, then we can be able to get the quantities and be ready to test whatever.
Does that mean that private hospitals, and government hospitals, any baby I designated to say Tema General Hospital, no Kolibono, and when so be the suspected case background, you don't do any test today.
No.
Sample.
You test sample no Gucci na test. Yes.
Oh, okay.
Yes.
I was thinking say be a mobile regular test. What kind of infection na when you na say then na someone who then Mark say okay, this one has to go to Noguchi.
So that's why assessment is important.
Okay.
And for example, Ebola time, they say, one of the things the only test we asked people to do was malaria. It is a obiaba, none share. Only malaria test. Or malaria test, none say negative. Then we can go on to do all the Ebola investigation. But we are not doing that. Once what I said is the case definition now. Immediately, I see a take samples near the Konoguchi, no more testing.
Okay. And now you're in charge of port services. When you say Ghana, you can or China pa. Inti shipments in Swat, a brave a free China ebano. You per se you who say and also you bay any day.
Okay. Inti virus no outside the environment no on surviving for that period. In fact, ship be free China. I be draw no. I'm not sure how long it is, but it will definitely be days, if not weeks. The virus will not survive in the environment for that long. Shipping this anomaly, I don't think we should be overly concerned about it. But of course, if they are coming with the crew from China, almost so they are a potential Temaport say. I know, say your colleagues now at the Temaport, no, they are doing the screening for crew members who are coming from that part. Okay. And then importantly, I think a lot of the times you focus on more Chinese and they look Chinese.
Okay.
But the truth is there are so many Ghanaians who go to China.
Yep.
And no so you will be anymore. They say China ba China ba. So it's important that we understand the preventive measures or the symptoms and report than say a Chinese won't know why she did with corona. Because before for in China, and I say be out to baby China need it or no boa. Hey, China need a boa no. But Oceana say be say boa. You might not protect yourself. But then so maybe I no. Wako China ba. Possible so why
okay.
My China for them say, but we should know say it's possible so anybody can have.
Okay. Now see akra I say China for nkwana ye hwe omo na once I had to say I spread ya ko other countries. Yeah. When we no so ye be any there because I shall say they can say China. Yeah. China kra no Wuhan na Wuhan province onum nanka a problem. But see here other countries more than 10. Yeah. And so I affected and also you can say.
Yeah, in fact, on the last count, 24 countries. The good thing, and I don't know whether it's good, but at least if you compare it to China, most of the cases are in China.
Okay.
The countries, about 24 countries now, a few, 1, 2, and most of them were picked before they could spread.
Okay.
And very contained. The risk of obia to kosa kronumu bagana carrying that infection quite low. Okay. But what we also know is that most of these big transit hubs until far airports airlines be brave.
Yeah.
You don't know who they have interacted with whilst they are in those terminals. You know sometimes screening we want to just say that look we are not you'll be.
It makes it scary.
Airborne diseases are always scary. Any disease are a number from droplet infection. Scary because Ebola de mojane nipa and those things now. And no, you rarely come into direct contact with that.
Okay.
But mutimi say airport cry ko fu plane yet bus ni mu kwa. Mujina close na so be sneezing by accident. I say what boy go so. Yes, enti eno na ma yare I spreading by air no dey thing bia no.
Na na wo ka say aboa no ntumi survive wa abonten enti niam aye kra free China no na medwen wo say ship na ship free China eba Japan for cruise ship we say emu na ebi mu dia komu ebi say bia na obi edan a captain bi crew bi o mo ship ne mu no odi ni dey free ho ba nti say ka niam ne nko asen say o ya soma niam na what if say niam no so onipa no loadi ye no I'm just thinking too.
I get it. It has to be. I don't have the exact figure for how long they survive outside, but it would definitely be. It won't be in days. It's definitely hours.
Okay.
If they even survive that long, most viruses outside, they don't survive that long.
Okay.
And as for the containers and those things, it's not an issue. And as I mentioned, Temaport, for example, we are screening the crew. And the intention is to screw across all our borders, not just the ports and the airport, but all the other entry points.
Entry points, including unapproved ones. Unapproved
ones, the bar na day. So unapproved, you'll be the unapproved ones, no. But I think that's where security comes in, for example. We will have to also engage the security to make sure that those unapproved routes, no, they have measures in place. But crew for no are checked. You spoke about the cruise ship. Cruise ship, and to say, even though it's a ship, no, and your ship are akofa.
Okay.
And somebody could have picked the infection and some ship, no, and then incubation period, no. As soon as was starting to show symptoms. It be there between 2 days, between there 4 days, but it's up to
it's a maximum
14 days.
Of 14.
Yes.
Okay.
So that's the information we have about the infection. On a cruise there, on a cruise, it's just like in normal society.
Okay.
People can still fall sick there, and once somebody falls sick, cruise is even more dangerous because it's a very enclosed area. Okay. And there's air circulating because of the air conditioning and everything. Risk near quite high on a cruise.
I see. So see, as a country, they are preventing, be it individuals and answer or mine.
Okay. So I think a lot of the measures are already in place. As a country, once we heard about it, and especially when, even before it was declared a public health emergency of international concern, what I said was enhanced screening at the airport.
Okay.
Because Obinya Arena, it cannot be spread.
Okay.
Until you want to pick Obinya Arena as quickly as possible and isolate the person so that it is not spread.
Okay.
Until those measures were done. And in fact, initially, you targeted airlines by 3BR. They have that connections from their hubs to China.
Okay.
It's Ethiopian, Emirates, and Kenya Airways.
Okay.
But once it was declared a public health emergency of international concern, so it's every international arrival who are being screened. And the screening, as I said, is just to pick cases quickly. Because mind you, we cannot stop people from coming in sick.
Oh, sure.
Say otiplane ni mo no wa start
ya exactly.
It won't mean cause oh ya yes. But once we pick you, then we put in the necessary measures to prevent spread. Okay. But yeah, as general public, because as we say,
general public, the more you airports, you my idea. Now to be double sure, I didn't think I'm more extending domestic ones, so cause it will be international, or basic but or connect your Chrome. Ewo Tamale, ewo Takrade, ewo Kumase, ewo Wa. Nti nka screening no mutu aso called domestic onso a nka emwana.
I think it's something we can look at, and especially if maybe a Nipano would stay for a while and Sana or move it on, because maybe after we screened, at the time I screened, maybe I don't need fever, but in a few hours I feel Kumase and I started developing symptoms. So it's something we can look at, and especially because I think about 20 or 25% of the passenger volume in Kutuka domestic, so it's quite a number. So I think it's something we will
take. Okay,
it's the general public in there. It's one of the things I always feel uncomfortable with, coughing in public.
Okay.
Nipa bebreboa, they don't cover.
On katana.
On katana no. Intubo so boa, and it's the only way you can spread it. If you don't cover it, it's your best amount for. And your coronavirus, you can go into. Okay. But it's your friend a cough etiquette. Said your work etiquette for boys and girls. A walk around your own etiquette. Into the boa, at least cover your mouth. With tissue and hanky.
Because me doctor boa na me doctor excuse me I can say hey we so rough for you.
Yeah, but I think say let's take advantage of this situation and let people know that it is not right. Say oh boa without covering your mouth. Okay. Worst case scenario, unkuta handkerchief cough into your sleeve. Oboa ni say obogua. of course, we are hoping that you are wearing a long sleeve.
Okay.
Because then the point is that it's less likely so people saw her compared with most likely if you cough into your hands, somebody would greet you. And obichawa obetimi e dey am say be kan zika.
Enti yesi cover no enyem po se wo do wonsa be
onsa no kra is no
enye kra. Enti de be boa ye wo tissue.
Yes.
Ana wo hanky. Hanky a wo be ubesi asaya toso.
In fact, median can menya crank a tissue. Because you see hanky no obo gumu wi a so de be so oboto. Obo say and you could still be spreading it. It's especially so say one of a wabi na ba fine, but say we yare na say o bowa as much as possible no tissue shell
okay.
Na mo bogu tissue na obo wi a then you dispose of it because okay. Yes we can spread into that is very important.
And my the tissue kita nya a problem but a memma no one was a memma no ne
and then me need be for me bag but me want hand sanitizer
a pocket tissue.
Yes, I think it's something we should encourage and then hand sanitizer and so okay. At least obi enya bi.
Okay. Eya na esu so ye nhwe ni say no so eya uti a doctor phone bi say mo amoye no koko no esa mo nhwe ne dodo.
At least ma onsa ne hu nyina anya wet.
M4.
Yes.
Okay.
Onsa ne hu nyina for then you know that you've had enough.
Okay. Okay. Doc, entire mama phone bisa questions e won puni mpusu na so we de ya pomodin asem e na e yo mamu ni nyina so concerns enti ye bebie kwan ato wo na amanfo kra enya mie no wo mo de abadada enti me hwe na mebisa wo questions ni bi e de ama wo mo as enwen na ebeba na me mfa me private phone if you say obi chairman be beside question and one way and say what happens to shipment from China to Ghana in terms of it handling okay when they arrive and don't see a problem and
it's still the individual.
Okay.
So nipa no mo so no money move from China na ba then we have to screen them and that's what we were doing at the port. It's crew for no will be screened but I think containers near they no say they are not handled by individuals.
Okay.
On the ship.
Okay.
I think there are cranes that lift them. We are now Ghana for local people. Yes.
Okay.
And I don't think, but crew need we are assessing them using the health questionnaire.
Look. And you're on a mess through. Now, once Ghana serious assembly, as I say, you did so yes. Now, Castle say a cofa addition for no free will hand bar. Or say a dream more entertainment fancy a ye baby to say University of Ghana hobby as Simon Hana, yen she say incubation period ni be tremono. Now, we have to factor in more entertainment in an Abranti be Jacob Arnold Kumpo say we can bring them home and let Shatawale entertain them.
I think it's
seriously.
You know because the WHO definition of health it's not just physical. Yeah. It's also your mental and your social. All those factors are important in people being healthy.
Okay. Doc, obi wo question hama yembisa mano Francisco Kumeju. I'll say me find out say if ujina obi a all smoking chen and tu benya na virus and smoking work tracker bi.
But you're smoking. Omo monum cigarettes generally. Omo risk so mbenya yare affecting lungs and as ya how and very high.
Okay.
And for them the risk is high. But then you smoke and as a cigarette no onum nintina. Ujan nche obenya
okay.
Say or yare dia obetimi spread and their risk is higher compared with omo smoking.
Okay. Yes. You can about said you're transmitting no and na aquafro yenchi the second say education ye name ade osuni say ya himfo etinase ankankan functions imuno wo matinase no wo mo ejenchia and they said for so long enti enu ne ebeye ne den yenhya se ma wo mo enhye gloves na omo nhye nose mask and protect your mo wana imagine no china eyi ahodo a war various places na amanfo na ntimi nka so onchia I mean yamamre no ye eho kakra no ono no concern ye chiefs no
say ade a ssc ye hwe ne engage traditional authority as well. Who be here? I'm saying me medical case Kumasi say, for example, you call programs are here.
Yeah.
And now say impokwesi there na say any festivals here and for no the city state to receive their subjects. We have to decide whether we want to do that, especially with the circumstances around now. But the key thing, and they say, you better say, possible, say, obi beti me at the arena ma, him for no. So on any chair, is an anati na no kekale na or the nizako for her. Obeti me and also in area no. Until we have to decide. Nana beti me the sanitizers in chain.
Okay.
Or chair kakra or paper nensa. But I think that people must understand why we do that. Enti no na encheche no ho be hia no. Em say yakase.
Omonti ase say denti as na dey sanitizer si.
Esi na na chair kakra no paper nensa no because it's not just nana nkwa na ebo ne ho ban if he does that.
Okay.
But empo no ni maybe another nipa na odi wani mo chair nana no. Ono ewo yare wa chair nana kakra ye nana say ozo akochia you might get it.
Okay.
A theoretical possibility.
Okay.
Enti no ye be hwe. But especially see any outbreak there, those extreme measures no. Yeah, na say yeah, taking things too far. But I think that the precaution should always be there. Enti nana another when they are sitting in states no more China, they should be aware say they are at risk.
Okay.
Into what measures can they put in place?
Okay.
And I believe say traditional authority too can say because of what is going on, yena say yenchia.
And then
I believe so. Because I know this also I need not.
But you are Ghana, we can oh money ni aseme ehuna ade enu Ghana.
And American. Say enu ha no ko kan. E be say they are pushing things far.
Okay.
And you know for me no, my recommendation is that we have sanitizers available.
Okay.
Now obia chia onko eden. Onko onfa bin paper nsa. And I say yeah, the Veronica buckets, you see, na home as always. I think those would also help.
Be better. Yeah. Okay, the akani na ye agro nti na emum e wo se wo san si en so e wo ya hweye mu e die na ye betimi aye se ankrankre efise nu hia pa ye ka o man de but ankrankre no ene ye o man no nti se ya nkasa ya na ye hu so ne yesi o enu won se ya na ye wo mentality bi se o enu Ghana na no pensu me ka che minuan mo mba mu si o Ghana de ene e ba se Ebola se a unya wa pan no na wa maje na tim no akekadu akonani ase garlic akra sumu na nchini gusu a wo betimi aye wontumi nyew ti we ya ye se na ma se si ai ye hu se mojanam ni ade oh mommy and any idea when you be won't na you know that kind of attitude.
Yes. Kind I think generally living healthy is important.
Okay.
Because no cigarette for example more risk for most infections of the high. No smoking, physical activity, exercise but at least we should try and be physically active. My hand hygiene say okay. It should be a practice.
Okay.
In a day, you should wash your hands several times, especially if you are moving and you are interacting with nipa bebre.
Okay.
Also sorts of doors move, and you're going out, and then hand hygiene is either with seminal issue and also with hand sanitizer. Now for one, it's not just corona but any cough. Nipa beboa eso bomode na ode tissue e kata wa no na face wo wi a dispose tissue no fa she ball mu now san hohoro nsa the fact that say ode tissue na kata wa no nche say entimi nyai nempo no the main thing say base wanya any of these symptoms why she obowa ohunmu finsuo sore throat ohumia insiso try and go to a health facility.
Okay.
Now you're sure. And especially if there's a history of travel to China, and now Obia Ofi China, Ethiopia, when your symptoms CBA, pass that information on to health worker. My health worker who say, Obia nya sa yare bi say wo fi, and also was starting maybe na sa nipa no bia we tu kwa China and na say we free nkuro ya sisu ibi and aba said the bear and no betimi atwen adwen akoso ntem because as I said symptoms no say you call most hospitals nipa baby wo ha mo symptoms ya mabodi so mo nko China and na enye corona other viruses in sutimi cause symptoms inti see you nya information na ye bomodin say will act on it.
Who can health facility but some call pharmacy cry health facility
pharmacy there quite first aid but they are not part of the formal health delivery system omo at the end of the system which is that ideally
in specific my ideally mean
hospital clinic health center chips compound those are the places I'll be called I'm sure and sani am drew
okay
pharmacists no bit me first aid in the pharmacy but it's not recommended practice.
Okay, yes. Now obi a wo genchia bebre bia MCs DCs ministers ahemfo obi a so onya sa
sanitizer and in fact enyo mo mo chia ngwa eso obi a obi me kra me obi she me bag
okay
nti eso obi a at least obi a obi and no ye easier because say me ka say bia me person na need you at me so I'll have to go somewhere but I can just pick my hand sanitizer and use nti no be very important.
Okay. Doc, on that note, ye beda wase papa passe ene wonya adaje ni yaba bedi enkomo yenso ye besere mu se de mwakase mo ya ma yen ubon se ba se yase oh everything is under control if you say ye te ho asemi mo boya no ho basa everything is under control ye nim se bibia betimi asidi but mo ma mo everything is under control na nya under control ampa. This suspected case, the person didn't pass through the port, and we didn't see, and we couldn't isolate the person, and we couldn't do this, and that's why the person came into the society or the community and infected others.
But yes, you're making sure, say, as general public, we are also alert. Into see nimobia what to quite nasa when your symptoms are. Let's advise. In fact, and your confrontation, say you're corny and any cocoa, if you China and abana wire into combat, yenche. Because, as I said, we need Obi to spread the disease.
Okay.
So long as we pick the person early, we'll put in the measures that Emma spread the number.
Okay. Sanitizers are okay. Ni na 100%. I go better no much or 99 point there.
Percentage need there. Anything above 60% alcohol. Above at least 60%.
Alcohol.
Yes.
What kind of side any munya pure crop
but most of them are not 60%.
Okay.
Most of them are less than 40.
Okay.
Or less than 50%.
Okay.
Indeed. But look, in the absence of anything, you can still use alcohol to clean your hands. But what we are saying is that sanitizers need there. Meaning say people might want to do other things, but we encourage that people make sure that someone import the right hand sanitizer. Okay. It should be at about 70%. That's the standard. But anything above 60, it's okay.
Thank you, Doc. Dr. Dennis Laryea, a national coordinator in charge of Ports Health, Ghana Health Service, and in the Dean Como say, you better den na amisie so a DNA coronavirus. If you say opportunity or China fa baby no and I wouldn't kakra water trace pebri muja akobe say 26 countries and paisana we see say 26 countries and I womo enya chefa ewomti untimi nka say oh media baby am won me we chichi one we are wadwen be also we chichi nanso na ebe ho pa enti na ye nyina yesua de yese ne say menye ne da yeti se enkosi aga debi fa na hiasem na ye de sese woye na bo ho ban na ya sra ban so say 2.5 million no baby ese mode ko na wo mode be ye adwuma no na aboa o mamu ni nyina no so na mo aye ni sa de amaye ene sa de ade da ekoso ya ne piti ene fie da de chenhweme di aye de ebremo ene impunimpu ni nyina ha ene DC ya kora mani mini ku ni nyina ya da wase kwan sonko so se na wotwemu nyina one yen etinaye emom echina ya de bibi sonko ebro anopa ewo eye adechenhwema brenifi no nso ekono enti tamchuku na hwe se woni ti 7 na edie na eba ochina no na hwe kwan you be business kwa ye de ebro makuma akonofo akuma papa bi Mrs Sandra ado a yetai say akosia wo kwabenya enansa Ashoma Estate ako ekuma konofo mema wache wusu petuza afene pa won said ya ende ne wo beka na ekuma mimum mababidi anti ye china ka che bra kofi Frank Ochiado Stanbic branch manager ewo Achimota say monhwe me kwan meba fi ho na mababidi tizeti ni bi makram bye bye